Hello everyone. Today we are going to cover few important topics from the subject veterinary pathology. Let us have a look at the contents today we are going to cover under this session. First, introduction. So under introduction we would discuss all the important definitions. Next, disturbances of protein metabolism, disturbances of carbohydrate metabolism, disturbances of fat metabolism. The next topic is necrosis and somatic death and gangrene. So in this slide, let us have a look at all the important definitions. First, we will start with pathology. Pathology means discourse of a disease. So the word pathology is derived from the Greek word. So when we divide this term into pathos and logos, pathos means uh, disease and logos means discourse. So it can also be defined as study of the diseases. Next is homeostasis. Homeostasis means the mechanism by which the body is kept in equilibrium. Next, disease. Disease means any departure from the healthy state. Next, oncology. Oncology means study of tumors. Etiology. Etiology means study of causation of the disease. Predisposing causes. Predisposing causes are nothing but they are the factors which makes the animal more susceptible to a particular disease. So these predisposing causes are also known as remote, distant or preparatory. Next is exciting causes. Exciting causes are also known as proximate, determining, immediate or direct causes. Next, pathogenesis. Pathogenesis means the mechanism by which the cause, that is the agent, produces the disease. Next, symptoms or signs. Symptoms or signs are nothing but they are outward manifestations of a disease. Next, lesions. Lesions means alterations in structures that are detectable microscopically or macroscopically. So, if a lesion is characteristic to a particular disease, then we can call it pathognomonic lesion. Next is diagnosis. Diagnosis is nothing but determination of nature of the disease. Next, incubation period. Incubation period means the time period between the action of the agent and disease manifestation. That is the time period between the action of the particular agent and the animal showing the clinical signs. So this incubation period could vary from few days to few years. So when it is acute disease like RP, the incubation period would be 4 to 9 days. If it is chronic disease like John's disease, the incubation period can extend up to some years. Next, course of disease. Course of disease is nothing but duration of the time through which series of changes which are characteristic to a particular disease, they pass through the ultimate end. Next is prognosis. Prognosis is nothing but outcome of a disease. So here we have morbidity. Morbidity means percentage of exposed animals getting affected. Mortality. Mortality means deaths among the animals affected. So if a herd of 100 animals are exposed to a particular virus and only 50 animals are getting affected, then the morbidity percentage would be 50%. Mortality. Mortality means out of the animals affected, how many number of animals are dead. So morbidity means animals getting affected and mortality means animal that are dead. So here again we have two important points. Diseases with high morbidity and low mortality. Low mortality means low death rate. High morbidity means that are affected. They are FMD and vaccinia. Next, diseases with low morbidity and high mortality. Mucosal disease. The next definition is autopsy or necropsy. Autopsy or necropsy means cut open a carcass. Biopsy means examination of tissues received from living animals. So here the main difference between the autopsy and necropsy is this term autopsy is used in human cases and necropsy is used in animals. Biopsy. So the main difference between this autopsy or necropsy and biopsy is that autopsy and necropsy is for dead carcass, but biopsy is tissue examination from a living animal. So the main difference is that biopsy is from a living animal, autopsy or necropsy is done for a dead animal. Next is predisposing factors. As we already discussed in the previous slide, Predisposing factors means these are the factors which make the animal more susceptible to a particular diseases. So again, in these predisposing factors, we have the factors which are heritable and non-heritable. So under heritable factors, we have lethal characters and sublethal characters. Both are inherited. But the main difference between the lethal and sublethal characters is lethal characters, they cause death. But sublethal characters, they only affect some of the bodily functions and they do not cause death. So the examples for lethal characters are Escherichia coli and parrot beak. The Escherichia coli is seen in horses and parrot beak in cattle. So the sublethal characters examples are infertility and scrotal hernia in pigs. So next, under non-inherited defects, we have anomalies. Anomalies means developmental defects affecting an organ or a body part. So under these anomalies, we have agenesis or aplasia. Agenesis or aplasia means complete absence. Next is hypoplasia. Hypoplasia means reduction in the size. Atresia. Atresia means closure of a lumen. Apart from this, we also have fusion of paired organs. Under fusion of paired organs, we have horseshoe kidney. This horseshoe kidney is also known as Ren arcuatus. So here we have some of the other predisposing factors. Those are genus, breed, age, sex and color. So under this we have bulldog. In bulldogs the brain tumors are very common, and in strangles, the strangles disease, it affects mostly the young horses, and here the pups are more susceptible to canine distemper infection. Okay, next, grey horses. The grey horses suffer more from malignant melanoma. And white-skinned animals are more prone to photodynamic diseases. Here we have two important points again. So diseases due to decreased atmospheric pressure. Brisket disease. Diseases due to increased atmospheric pressure is Cason's disease. So as we go along the higher altitudes, there is decreased atmospheric pressure where we see this Brisket's disease, and increased atmospheric pressure is seen when we go deeper into the seas. So this Cason's disease is generally seen in the people who go for diving. Next, the vagina is kept free from pathogenic organisms by lactobacillus, that is Doderlin bacillus species. So here we have very important topic, that is disturbances of protein metabolism. In this, first we have parenchymatous degeneration or cloudy swelling or albuminous degeneration. So these synonyms are also very important, which can be asked as bits. So under this, this degeneration is the earliest. So it is the earliest of all, and there is alteration of physical states of the cells. So this is again very important. What are the factors which causes this parenchymatous degeneration? Those are hypoxia and toxins. So the affected organs appears as swollen and parboiled. This is very important. So the affected organs, they look like they are parboiled and they appear as swollen. And the cells appear as ground glass. So the cells have ground glass appearance. And the cell organelle mitochondria is affected. So as a result, there is increased accumulation of these sodium ions, and as a result the cell appears swollen. So this is very important for the bits. So the next one is hydropic degeneration. So in hydropic degeneration, the cytoplasm has one or two vacuoles. So the classical example for this hydropic degeneration is blisters, vesicles in disease pox and FMD, which is again very important. Next is hyaline degeneration. So under hyaline degeneration, we have this connective tissue hyaline, epithelial hyaline and muscle hyaline. First, let us have a look at this connective tissue hyaline. So under connective tissue hyaline, we have these examples. So the important ones are arteriosclerosis and scar tissue. Next, let us have a look at this epithelial hyaline. So, under epithelial hyaline, the classical example is stratum corneum. The stratum corneum is physiological. So, under pathological epithelial hyaline, we have this hyperkeratosis. Hyperkeratosis is seen when there is deficiency of vitamin A. And similarly, this is also seen in corpora amylaceae. Corpora amylaceae is seen in prostate gland. It stains with iodine-like starch. And this is also seen in diabetes condition. So next we have muscle hyaline. So in hyaline degeneration of muscles, the muscle fibers become homogeneous and glassy-like, and they undergo so-called degeneration called Jenker's degeneration. So some of the muscles that are undergoing hyaline degeneration are rectus abdominis in typhoid disease, and in equine azoturia, and in calves white muscle disease, and stiff lamb disease in lambs. So the affected muscles, they appear like fish flesh and they lose all their fibrillar staining. The causes are hypoxia, anaphylaxis and tumors. Next we have mucinous degeneration. So normally the cuboidal or columnar cells, they secrete this mucus or mucin under normal condition, but under pathological condition what happens is the epithelial cells, the normal epithelial cells, they produce excess of this mucus or mucin and they also undergo degenerative changes. Okay, the causes of this mucinous degeneration are irritant, also in canine distemper and viral diarrhea. So here the important point is that the mucus, the normal mucus gets precipitated by this acetic acid, and coming to the staining of this mucus, it stains blue with hematoxylin, purplish red with pus and blue with Alcian blue. So this staining is very important for the bits. Next we have this condition called cystadenoma of ovary. So this cystadenoma, it produces pseudomucin, and so here the important point is that what is the difference between this pseudomucin and mucus. So here the mucus is getting precipitated by acetic acid, but this pseudomucin is not precipitated by acetic acid, and also this stains pink with eosin, whereas the mucus stains blue with hematoxylin. So these are the main differences. Next we have mucoid degeneration or myxomatous degeneration. So normally mucin is produced by fetus but not adult cells. So when there is production of this mucin, it means they have undergone this mucoid degeneration or myxomatous degeneration. Under this we have three classical examples which are very important. First is neoplasms. So under neoplasms, the myxoma or myxosarcomas. So they in these conditions there is mucoid degeneration. So here the myxoma or myxosarcoma, they appear as stellate shaped and they have long branchings, and this condition is also seen in malnutrition and myxedema. Next we have amyloid or waxy degeneration. So under this amyloid or waxy degeneration, first we have amyloid. So what is amyloid? Amyloid is a protein. It is nothing but globulin plus sulfated polysaccharide. So this amyloid or waxy degeneration is very common in horses and dogs. So again this is very important. In horses, the horses which are used for the production of anti-sera, so there is antigen and antibody reaction. So we see amyloid degeneration. So what is amyloidosis? Amyloidosis means proliferation of protein producing cells. So here amyloid is nothing but it is a protein. So in birds, we see spleen amyloidosis in TB. So in TB in birds, the spleen is affected mostly. So there is rupture of spleen and the death of the bird is due to the rupture of spleen. And under amyloidosis, we have the most affected organs. Those are liver, kidney and spleen. So first, let us have a look at the spleen. So under spleen, we have again two conditions, sagospleen and Bacon spleen, which are again very important. So under sagospleen, the sagospleen is also known as focal. So this sagospleen or focal is very common condition when compared to this Bacon spleen. So here what happens is there is depositions. So the amyloid gets deposited around the central arteries of the malphizian corpuscles, and all these appears as grains of boiled sago. So as a result it is known as sagospleen. Next we have the condition Bacon spleen. So this condition is very rare, and here the deposition of amyloid is seen in the connective tissue of sinuses and reticulum pulp, and also the organ appears enlarged, and unlike sagospleen, here the infiltration is more diffuse. Next, liver. So under liver, liver gets swollen. Kidney. This is again very important. So kidney appears as spotty kidney. So the appearance of kidney is spotty. This is again important for the bits. Coming to the staining, the staining can be asked as bits or also as matching. So this is very important. So with iodine, it stains mahogany brown. With iodine plus 1% hydrogen sulfide, it stains blue or black in color. With methyl violet, there is metachromatic staining. So the amyloid would stain rose red in color and the remaining blue. Congo red. Congo red staining is very important in for amyloidosis, amyloid degeneration. So the amyloid would stain deep red color with Congo red. So this Congo red is given in the root IV. Next we have weak iodine solution. So with weak iodine solution, brown spots appears. Next is fibrinoid degeneration. So this fibrinoid degeneration, the examples are, it is seen in collagen disease of man. So it is fibrinoid degeneration. Fibrinoid degeneration is seen in collagen disease of man and also in FMD, swine erysipelas, polyarteritis nodosa. So here the mesenteric arteries are generally affected. Next we have disturbances in carbohydrate metabolism. Here we have glycogen infiltration. In man, there is glycogen storage diseases. So under the glycogen storage diseases, we have two diseases. First one is Van Geryck's disease and the second one is Pompe's disease. So under first disease, it is due to deficiency of glucose 6 phosphate. So as a result, there is accumulation of this glycogen. And the second one is due to deficiency of alpha glucosidase. So these two are very important for the bits. Next we have Best's carmine stain. So this stain, it stains glycogen in as bright pink color. So this is a special stain which is again very important for the bits. Next, so the next topic is disturbances of fat metabolism. So under this we have lipotropic factors. So what are lipotropic factors? These are the factors which help in conversion of fats to phospholipids, so that the body can use these phospholipids precisely. Okay. So these are choline and methionine. So under these disturbances of fat metabolism, we have fatty changes. So under these fatty changes, we again have fatty infiltration and degeneration. So the fatty infiltration and fatty degeneration combinedly known as fatty changes, infiltration and degeneration. First, let us have a look at fatty degeneration. So in fatty degeneration, the mitochondria gets damaged. As a result, fat metabolism gets disrupted. So fat becomes visible. Here, what are the changes occurring? So the nucleus is not displaced. Next, the nucleus undergoes pycnosis or karyorrhexis. Next, the vacuoles are small. Here, the heart has appearance of thrust breast appearance. So this is called so because there is fat on ventricular endothelium, and this is very important. So the thrust breast appearance of heart is seen in fatty degeneration. Next, the important cause of this fatty degeneration in liver is CCl4. This is again very important. Next we have fatty infiltration. So in fatty infiltration, unlike fatty degeneration, there is metabolic derangement. So due to this metabolic derangement, what happens is large quantities of fats, they get metabolized to the liver. So the liver becomes incapable of metabolizing the fats. So as a result, the fat gets accumulated in the liver cells. Here the nucleus is not displaced, but in fatty degeneration the nucleus is displaced, and also here the vacuoles are small, but here the vacuoles are large. So what is the sequelae of this fatty infiltration? It is cirrhosis of the liver. Here the fat solvent is xylol, which is very again important, which is again very important. Here the fat solvent is xylol. So, if the sections are passed through the xylol, then staining would not be possible. So here we follow this freezing microtome technique. What we do here, we avoid passing of sections through fat solvent prior to staining. Next is staining of this fat. Okay, so what happens here? Here we have excess of fat. So here we have excess of fat. So we should stain the fat. Next we have is staining. Under staining, these are very important for the bits and also for matching. First we have osmic acid. So with osmic acid, black color. Next Sudan 3 and 4, scarlet red and oil red O. So with this, the fat would stain red in color. Next we have bovine ketosis. So this bovine ketosis is also known as acetonemia. So as a result of impaired carbohydrate and fat metabolism, we see this condition. So under this we have primary ketosis. Primary ketosis means uncomplicated. Secondary ketosis is due to some other complications. Nutritional ketosis results from malnutrition. Elementary ketosis. So this elementary ketosis is due to feeding the animal with the silage rich in butyric acid. Here we have three ketone bodies. The first one is acetic acid, butyric acid and propionic acid. So the acetic acid and butyric acid are ketogenic and the propionic acid is glycogenic. Next we have necrosis and somatic death. So what is necrosis? Necrosis is nothing but local death of the cells or tissue in a living body. So this involves local death. Next is somatic death. Somatic death means death of body as a whole. Next is necrobiosis. Necrobiosis is also known as physiological death. So here the changes occurs in cells while they are dying. So during death, what are the changes that occurs in a body? It is known as necrobiosis. So in mushroom, there is a toxic glycoside which is known as phthalate. So what is the toxic glycoside which is present in mushroom? It is phthalate. What it does? It causes necrosis of renal tubular epithelium. So some of the changes. So again, here we have few important points. First one is pycnosis. Pycnosis means the nucleus becomes smaller, round and condensed. There is no internal structure and nucleoli is also absent. Next one is karyorrhexis. Karyorrhexis means fragmentation of nucleus. So this condition is found in caseous necrosis. Next one is karyolysis. Karyolysis means dissolution of nucleus. Next, chromatolysis. Chromatolysis means disappearance of nucleolus, chromosomes and other stainable materials. So these four definitions are very important for the bits. So what are the types of necrosis? Under types of necrosis, first we have coagulation necrosis. So in this coagulation necrosis, the architecture is preserved and cellular details are lost. So only the cellular details are lost and the architecture gets preserved and inflammatory line is also present. So the important examples under this coagulation necrosis are glomeruli, infarcts of spleen and kidney. So in white muscle disease and the spirophorus necrophorus infection, that is necrotic liver in cattle. Next we have caseation necrosis. So the classical example for this caseation necrosis or where this caseation necrosis is seen is in TB. So this is very important. Here we have cheese-like and granular appearance of the affected tissue. So the calcium deposits occurs due to increased fat content and here all the details are lost. That is both the cellular details and the architecture is also lost. But in coagulation necrosis, architecture is preserved. Here calcification may be present and fibrous capsule is found. Next we have So next we have colliquative or liquefaction necrosis. So under this we have by the action of intracellular autolytic enzymes or due to the proteolytic enzymes. First let us have a look at this. By the action of intracellular autolytic enzymes. So this condition is seen in brain. So the main necrosis that is occurring in the brain or CNS is this liquefaction necrosis. This is due to it has high lipid and water content and low coagulable albumin. So the examples under this liquefactive necrosis are infarction, cobalt and cyanide poisoning, crazy chick disease, thiamine deficiency and moldy corn poisoning. Next one is by the action of proteolytic enzymes or of leukocytes. So under this the very important example is abscess and estrus ovis. Here the fibrous capsule is present and also a pyogenic membrane is present. Next one is next we have fat necrosis. So under fat necrosis we have traumatic fat necrosis and enzymatic fat necrosis. Under traumatic fat necrosis it is seen in perivaginal fat. So when there is trauma, the fat cells get engulfed by the macrophages. So these appear as foreign body giant cells which again appear as nodules at this region. Next we have enzymatic necrosis. Here what happens is due to the action of this pancreatic lipase on the fats, there is hydrolysis of the fats into glycerol and fatty acids. So again, some of the minerals like calcium, potassium and sodium, these combine with the fatty acids and they form soaps. So here in enzymatic necrosis, we see some of the chalky masses and also the inflammatory reaction is present around the chalky masses. Next we have autolysis. So next we have autolysis. In this autolysis, what happens is the nuclei disappears and all the cellular details get lost. Okay, so there is rapid autolysis in liver, kidney, adrenals and bone marrow, and slow autolysis takes place in skin and brain. So what is the difference between this autolysis and necrosis? So in autolysis, there is uniform death of the cells and also no inflammatory reaction. But in necrosis, there are some of dead cells and living cells. So there is no uniformity. It is a mixture of dead cells and living cells. And also the inflammatory reaction is present. Next we have gangrene. What is gangrene? Gangrene is nothing but necrosis plus putrefaction by saprophytic bacteria. So what is necrosis? Necrosis means localized death of the cells. So along with this death of the cells, we have putrefaction by the action of this saprophytic bacteria. So in this we have again dry gangrene and moist gangrene and gas gangrene bacteria. So here we have a very important point, that is ergot poisoning. So in ergot poisoning, there is contraction of the smooth muscle as well as contraction of arterioles. So this results in dry gangrene. Okay, this is seen in extremities of the limbs. It is very important for the bits. So again we have two important points, acids and alkalis. So the acids, what they do, they coagulate the fluids, so they result in dry gangrene. But alkalis, they cause liquefaction of the tissues, so they cause wet gangrene. So let us have a look at dry gangrene and moist gangrene. So what is the differences between the dry gangrene and moist gangrene? So dry gangrene is seen in extremities, whereas the moist gangrene is seen in internal organs like intestines. So here there is evaporation of moisture due to dehydration. Here there is foul odor due to production of these indole and scatol. This is dry and cold, whereas this is hot and moist. So the dry gangrene spreads very slowly. It spreads in the direction of blood flow and it stops where there is adequate blood flow. This is spread rapidly. So here what happens? The hemoglobin, it fuses with H2S, resulting in formation of foul smell and greenish blackish color discoloration. So it is similar for both dry gangrene and wet gangrene. Here the line of inflammation is seen, that is there is demarcation between the dead tissue and the living tissue. Here no line of demarcation. Next we have gas gangrene. So this gas gangrene is due to action of this anaerobic spores of the Clostridium species. Some of the species are Clostridium chovy, which causes black water, Clostridium septicum, which causes malignant edema, Clostridium novae, which causes black disease. So in this gas gangrene, commonly thigh and shoulder muscles gets affected. So here again we have two important points. Neurons. Neurons once dead, they are lost. There is no degeneration. And high regeneration capacity is present in hepatic cells and fibroblasts. Next, somatic death. What is somatic death? Somatic death means the respiration and cardiac activity have stopped. Next, algor mortis. Algor mortis is nothing but cooling of the body. So the next topic is what are the changes that occur after death. In this first we have rigor mortis. Rigor mortis is nothing but contraction of muscles after death. So this rigor mortis occurs first in active muscles. So this rigor mortis occurs from head to hind limb, and it also resolves in the same direction, that is from head to the hind limbs. So this rigor mortis, it appears in 1 to 8 hours and it disappears in 20 to 30 hours. Next we have PM staining, that is post-mortem staining. So here we see a condition called pseudomelanosis coli. Here what happens is the intestines, they get stained by this iron sulfide. Next we have PM softening. So this PM softening is due to autolysis of the tissues. Next we have PM clotting of blood. So due to degeneration of the endothelial cells after death and leukocytes, there is the release of thromboplastin, and as a result the blood gets clotted. So here we have white clot and red clot. The white clot is also known as chicken fat clot and red clot is known as currant jelly clot, which is again very important for the bits. So in anthrax, there is release of fibrinolysin. So as a result, there is absence of clotting of the blood. And in sweet clover poisoning, prothrombin is inhibited. So here also we see hemorrhages. The blood is not clotted. These are very important.